back to my channel. For those who are new, my name is Ina and I'm a registered nurse. And for those who are new as well, thank you so much for subscribing. So today is going to be a really exciting topic, and we're going to talk about 5 things you will need to know before you go into your first class of nursing school. And watch this video until the end, because we're going to talk about how much does nursing school cost, okay? So first thing that you will need to know is expect you're going to be really busier, much busier than you've ever been. Nursing school is all about having a really busy schedule. With 6 courses at a full-time studies, you're going to have physiology, pharmacology, psychology, and a whole bunch of nursing courses. So you're going to study a lot. Number 2, you will need to understand a lot of nursing concepts, and not just memorizing them, but instead you will have to actually know them, because you're going to have to apply them into different courses and different structures of these courses. And before we go on with this video, please like that subscribe button and comment below and like this video if you did like it. Thank you guys. So number 3, you will have simulation labs in nursing school, and that prepares you for further clinicals. So what that means is you're going to have something like actual patients and scenarios that you will have to deal in your real life patient scenarios, okay, just before you go into clinicals. Now, many students think that maybe their clinicals will start in their first semester, but no, you will be surprised. That is number 4, is that clinicals do not start until at least second semester. And that is because you will need to do those simulation labs before you go into clinicals, and you want to grasp first of all some information about what's going on, some of the diseases, nursing diagnosis, how to create some care plans, and you will need to familiarize yourselves with a lot of different information before you go into clinicals and you feel a little bit more comfortable working with real patients now. So that is really exciting, okay? Now, number 5 is maybe surprising, but you will read and write a lot in nursing school. So which means there's going to be different books as resources. And they're big books. They're not just novels or anything like that. They're huge books that you will have to read, and you will write a lot of research papers in nursing school. So such as, for example, qualitative, quantitative studies. So there's different things and variations that you will be prepared to write. As a tutor, I help a lot of students how to write different research papers, how to gather information and put it all together. When I was a student, I started in a nursing school, I struggled to get these concepts into the real research papers. But as the years moved forward and completing my degree, I understood that I've mastered this skill, and now I help others to achieve how to write different research papers, as a matter of fact. So, and that is number 5. And also, what I wanted to discuss with you is a lot of students ask me before going into the nursing school, because there's certain students that prepare before they go into nursing school, and they need some tutors, guidance, and advices. And they also want to know how much is the program cost. So this number may or may not surprise you, but it also varies from one school to another, from one jurisdiction to another, which means different provincial costs, and there's different taxes that apply. So approximately nursing school costs $40,000, but that not includes some books, meal plans, parking, and miscellaneous. It could be anything that you will need in the nursing school. However, if you're an international student, the costs usually double, okay? That's just for the tuition fees. Okay, in the next video, I'm going to talk about, it's called a bridging programs, and that applies for LPNs, which is licensed practical nurses, or in some jurisdictions, they're called RPNs, registered practical nurses, and even college RNs. So we're going to talk about why people go in bridge, what that means, how long does it take, and can you become a registered nurse after you're bridging? Okay, that is very important because a lot of nurses and students, while going into even the school, they don't really know about this concept, and it often is not talked about. So it's very important to know what your options are. Thanks so much for watching this video, and I'll see you in the next one.